Trauma-informed care emphasizes the importance of behavioral health practitioners and organizations recognizing the prevalence and pervasive impact of trauma on the lives of people they serve and of developing trauma-responsive services. SAMHSA defines trauma as the result of an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Although many individuals report a single specific traumatic event, others, especially those seeking services for mental health or substance use disorders, have been exposed to multiple or chronic traumatic events. Trauma-informed care takes a trauma-informed approach to the delivery of behavioral health services that includes an understanding of trauma and an awareness of the impact it can have across settings, services, and populations. Trauma-informed care views trauma through an ecological and cultural lens and recognizes that context plays a significant role in how individuals perceive and process traumatic events, whether acute or chronic. TIC involves vigilance in anticipating and avoiding institutional processes and individual practices that are likely to re-traumatize individuals who already have histories of trauma. TIC upholds the importance of consumer participation in the development, delivery, and evaluation of services. Many individuals experience trauma during their lifetimes. Although many people exposed to trauma demonstrate few or no lingering symptoms, individuals who have experienced repeated, chronic, or multiple traumas are more likely to exhibit pronounced symptoms and experience negative consequences, including substance use disorders, mental illness, and physical health problems. Trauma can significantly affect how an individual functions in major life areas in response to treatment. Many people who have substance use or mental disorders have experienced trauma as children or adults. People with substance use disorders who have experienced trauma have worse treatment outcomes than those without histories of trauma. Traumatic stress increases one's risk for mental illness and increases the symptom severity of mental illness. Individuals with serious mental illness who have histories of trauma often present with other psychological symptoms or disorders commonly associated with trauma, including anxiety, mood, and substance use disorders. Substance use and mental health disorders increase the risk of experiencing trauma, and trauma increases the risk of developing substance use and mental health disorders. The 4 R's, key assumptions, and a trauma-informed approach. A program, organization, or a system that is trauma-informed realizes the widespread impact of trauma and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. Trauma-informed principles. Number 1. Promote trauma awareness and understanding. Recognize the prevalence of trauma and its possible role in your client's life. Number 2. Recognize that trauma-related symptoms and behaviors originate from adapting to traumatic experiences. View your client's responses to the impact of trauma as adaptive. Regard the client's presenting difficulties, behaviors, and emotions as responses to surviving trauma. Number 3. View trauma in the context of the client's environment. Consider the context in which the trauma occurred. Number 4. Minimize the risk of re-traumatization or replicating prior trauma. Take practical steps to re-examine treatment strategies, program procedures, and organizational policies that could cause distress or mirror common characteristics of traumatic experiences. Number 5. Create a safe environment. Be responsive in adapting the treatment environment to establish and support the client's sense of physical and emotional safety. Number 6. Identify recovery from trauma as a primary goal. Remember that your client is less likely to experience recovery in the long run if treatment for mental and substance use disorders does not address the role of trauma. Number 7. Support control, choice, and autonomy. Create opportunities for empowerment. Doing so may help reinforce your client's sense of competence, which is often eroded by trauma and prolonged traumatic stress reactions. Number 8. Create collaborative relationships and opportunities for participation. Remember to shift the perspective from we, the providers, know best, to the more collaborative, together, we can find solutions. Programs that incorporate peer support services reinforce a powerful message that provider-consumer partnership is important and that consumers are valued. Number 9. Familiarize the client with trauma-informed services. Explain the value and type of trauma-related questions that may be asked during the intake process. Educate clients about trauma to help normalize traumatic stress reactions and discuss the rationale behind specific interventions. Number 10. Incorporate universal routine screenings for trauma. Universal screening provides a steady reminder to be watchful for past traumatic experiences and their potential influence on clients' interactions and engagement with services. Number 11. View trauma through a sociocultural lens. Understand that culture influences the interpretation and meaning of traumatic events and the acceptability of symptoms, support, and help-seeking behaviors. Number 12. Use a strengths-focused perspective. Promote resilience. Focus on the client's strengths. Shift the focus from what's wrong with you to what has happened to you, what has worked for you. Number 13. Foster trauma-resistant skills. Focus on developing self-care skills, coping strategies, supportive networks, and a sense of competence. Number 14. Show organizational and administrative commitment to TIC. Number 15, develop strategies to address secondary trauma and promote self-care. Remember that the demands of providing care to trauma survivors cannot be ignored. Secondary trauma is a normal occupational hazard for behavioral health service providers. Number 16, provide hope. Recovery is possible. Traumatic stress reactions are normal reactions to abnormal situations.